We'll continue talking about the physiologic changes that occur in older adults. The respiratory system itself, the size of the airway overall increases. However, the surface area of those alveoli where they exchange carbon dioxide and oxygen actually decreases. The natural elasticity of the lung decreases, so they end up having to use more intercostal muscles in order to breathe, and breathing becomes just more labor intensive. It's tiring to breathe as you start to age. The changes within the respiratory system are pretty gradual and tend to go unnoticed until there's a severe condition that occurs, an illness that makes things extremely hard for them to breathe. And then all of a sudden they're like, oh, yeah, something's wrong here. Aspiration or breathing material into the airway that's not supposed to be there, and obstruction, choking are much more likely once you progress to this. Your cough reflex becomes much less efficient than it was before because of loss of muscle capacity. Within the mouth, nose, there's a gradual loss of the mechanism to protect the upper airway. So that cough reflex is certainly one of them. Cough reflex comes from something getting back there and stimulating receptors. You kind of lose that. You lose sensory as well. So now you have an inability to clear secretions, but you also have a decreased gag reflex. As that smooth muscle of the airways begins to weaken with age, it's really hard to have a strong inhalation without the walls of the airway collapsing. So you end up getting what's called inspiratory wheezing. So wheezes as you draw air into your lungs. On top of that, the cells of the immune system are less functional, so that makes those older adults much more susceptible to respiratory diseases. By the age of 75, the vital capacity may amount to only 50% of that of a young adult. Factors of this include the loss of the muscle mass, the increased stiffness of the thoracic cage, as well as decreased surface area that's actually available for exchanging air. You lose the surface area of those alveoli and you really can't get it going. However, the residual volume increases with age, so that amount that's left in there after you breathe in, breathe out. A lifetime of breathing, especially when you're breathing in pollution and other factors that just aren't healthy for you, that starts to build up over time and ends up damaging the lung itself. The endocrine system, insulin production starts to drop off, and so diabetes is more prevalent. Metabolism itself decreases. You have a decrease in energy because of that. Metabolism helps progress and produce energy production within your body, and so when that starts to slow down, you just don't have as much energy. People tend to slow down physically, but don't necessarily adjust their food intake, especially here in the United States. We eat more for the psychosocial aspect of it rather than the nutritional value. Our portion sizes are much larger than most of the world because it has nothing to do with the nutrition itself. Your reproductive system changes a little bit here as well. Men, however, are able to produce sperm well into their 80s, but they tend to have a harder time sustaining an erection, which kind of is necessary in order to reproduce. They often have to find a woman that is significantly younger for the most part because of that menopause that occurs between 40 and 50. Women lose the ability to procreate well before that of the male. Women have a decrease in size of their uterus and of their vagina now that their body is not set on being prepared to produce offspring. You don't really need those anymore. Hormone production for both sexes gradually decreases with age overall. Sexual desire may diminish with age, but it certainly doesn't cease. Many adults remain sexually active well into their older adult years. The digestive system, taste sensations tend to decrease. So foods that have had a significant flavor really don't have that significant flavor anymore. A lot of older adults tend to over season their food in order to taste it more. Saliva secretion decreases. This reduces the body's ability to process complex carbohydrates. The whole reason that you have enzymes in your saliva is to start breaking down complex carbohydrates. Those are the starches and sugars that we intake. The ability of the intestines to contract and move food diminishes. This leads to constipation. I mean, mostly speaking, can also lead to indigestion as well. Gallstones become increasingly common, and that reduces the ability to process fats. Gastric acid secretion diminishes as well. And then anal sphincter changes can produce fecal incontinence. So even though they have the capacity to hold their stool, a lot of times physiologically they can't. Renal system definitely has huge changes. The filtration function declines 50% from age 20 to age 90, so a lot. Your kidneys will be working half as well, essentially. Your kidney mass will decrease over 20% in that same span, and this is often due to the decrease in effectiveness of the blood vessels that actually supply the kidneys themselves. There's a decreased ability to clear waste from the body. Where this comes into play is all those medications that patients are on when they hit that older adult range can start building up in the body, causing overdoses where it normally wouldn't do that if kidney function was adequate. And then there's more chance for different drugs to react with each other because there's that increased amount of medication. You also have a decrease in ability to conserve fluids. Your kidneys do a lot for maintaining blood pressure and hydration status. Since they're not working effectively, it's really hard for it to help with that. Your nervous system, the brain will shrink 10 to 20% by age 80. So motor and sensory neural networks become slower. They don't have the reactionary time that normal adults would up into middle adulthood. Neurons are lost, so you end up having a decrease in the number of neurons. However, there's no change in knowledge or skill. Truly, we use a very small portion of our brain, and so we don't tend to lose those abilities. Sleep patterns do tend to change because of the loss of neurons and some of the other changes within the brain. In younger adults, the brain is surrounded by meninges, which is just protective coverings, and takes almost all of the space up within the skull. It's pretty darn tight in there overall. However, that shrinking with those age-related changes allows for void space within the skull. So now where your head, could take a blow and your brain wouldn't move very far, now all of a sudden your brain has room to bounce around in there. And so you end up with a lot of head bleeds because of that. So that's where your strokes start coming into play as you age. Peripheral nerve sensation is also diminished. So a reaction time can cause longer delays between stimulation and motion. This tends to increase injuries and the severity of injuries because they can't feel the pain that should be slowing them down. And then those slowed reflexes also make them susceptible because, I mean, if you put your hand on something hot, you're going to pull away very quickly. It takes a little bit longer for them to process, holy cow, this is hot. Sensory changes. Most older adults can see well or hear well, but they may need assistive technology. So glasses, hearing aids, in order to help them out. Don't assume that an older patient is blind or deaf, and visual distortions are common. Hearing loss is 4 times more common than vision loss.